everyone, welcome to week 7. I hope you had a nice relaxing break week. You got to spend some time with your family and just maybe not study quite so much. I can see that some of you have been working ahead, which is great if that works out for you, but I hope you did take at least a little bit of time to relax and enjoy a little bit of a breather. So as far as the videos from part 1 went, you guys did a fantastic job. That's really hard. That first video is really hard to kind of get into the rhythm and know what the expectations are. But I think you guys did a great job. The biggest takeaways I can share with you are to just really follow along your rubric and the Jarvis text together. The rubric kind of gives you the overall what we're looking for, and the Jarvis text goes into the nitty-gritties of what we're looking for. So using those together and going through those will just make your video that much easier, and you'll be able to capture as many points as possible for all that work you've put in. So let's look at the upcoming week. And so again, week 7. Cardiovascular and peripheral vascular, that's the focus for this week. There's some resources here for you to review and go through that are really helpful and can help you in performing your upcoming exam. So take the time to read those. They can clarify a few points for you as you go along. There are no forums or activities or anything due by the end of the week this week. This is really just allowing you the time to focus on your readings and getting your videos down and submitted by the end of the week. So this week's video will be the HEENT video part 2. So let's go ahead and look at that. And this video will be a maximum of 10 minutes in length. Try not to rush through your video. If you need to use all 10 minutes, that's fine. Just make sure you're hitting all of the required points. I know when you are speaking in public or being recorded, you'll feel like you want to rush through everything, but try and take your time and not feel like you're being rushed. So again, you're going to record your video and upload it just like we did last time. And again, you'll also have the rubric that you can go through again after you feel like you've done your best shot at the video. Watch your video with your rubric and looking at your Jarvis text, and write down any items that you missed, why you missed it, and what you would have done. You need all 3 of those things to gain all the possible points back. You can't just say, I missed lung sounds, for example. You have to say, I forgot the lung sounds when I was recording my video. This is why I missed them. I was thinking about heart sounds that were coming up next and trying to make sure I wasn't going to forget any of those steps. What I should have done was, and then follow through, like listen to every lung sound in every lung field, however many there are, and what your findings would have been. So telling me I missed my lung sounds gets you 0 points back. So make sure you go through all of those steps, but it's way easier to do that than to re-record your whole video from the beginning. So those are the highlights for this. Let's look at the rubric together, and that is right here as well. I have it open here. So let's look at the rubric. And it's very similar start to the last one, before, during, and after the procedure. Identify the patient with an obviously fake name. John Doe, Jane Doe, Santa Claus, whatever. Standard precautions. Using gloves when you need to. If you don't have gloves, verbalizing like, obviously I would use gloves if I was in a real setting. Hand hygiene. A lot of people will have hand sanitizer that they'll just rub on as they're introducing themselves, or they'll say, I'm performing hand hygiene, and kind of go through that. Ensuring privacy. Let's say we're in a private room, the door's shut, it's just the 2 of us here. Introduce yourself to your patient. You can introduce yourself as a student nurse midwife and the reason for the exam. Explain the exam to the patient and say, if you ever feel that you're uncomfortable, please let me know and we can modify the exam. Moving on now into the eye exam, we have extraocular muscle function testing that we'll do next. And you only need to perform one of these tests, either the corneal light reflex or the diagnostic positions test. And those are both found on page 286. I wanted to go through those just a little bit with you to make sure that you get those done correctly. So for the corneal light reflex, you're going to shine a light toward the person's eye and have them focus on an object and just keep staring at that object while you shine the light on the person's eye while they look straight ahead. The light will be about 12 inches away from them. And you're noting the reflection of the light off of the two corneas together, and you want to see where that light is reflecting back at you. And those should be in exactly the same spot on each eye. So you're noting symmetry. And there's an example of that in the book as well. Or you could do the diagnostic positions test. That's also on page 286. And that's assessing the 6 cardinal positions of gaze, looking for any muscle weakness during movement. So you're going to have the patient hold their head steady, and without moving their head, they're going to follow like either a pen or your finger, and you're going to hold that object about 12 inches away from them and move it in the 6 cardinal positions. You're going to, don't just go like this. You're going to go, okay, just follow my finger and don't move your head and bring it always back to the starting point. And when you get to each point, just rest for a second. Out and back, down and back, and then on the other side. So making sure that you're not skipping the pause at each spot and that you're hitting each of those 6 positions and giving them the correct information. And then recording what your findings would be. That was one other thing on the previous video, just to point out that as you're doing these assessments, talk through them. Tell me what you're looking for and what your findings are. You maybe wouldn't always do all of that in a normal exam, but when I'm doing an exam on a patient, I'm like, I'm just going to listen to your lung sounds. Oh, they sound clear. Listen to your heart. It's nice and regular. Sounds normal. We'll give more information in our videos, but it's helpful for the patient to know what you're doing too. So just talk through your video. The more you talk, the more points you'll be getting as it goes along. So that's the number 4 there. And then you're going to do number 5, and that's inspecting the external ocular structures. So noting the eyebrows, the eyelids, the eyelashes. And for example, the eyelids, there's symmetry between the 2 eyes. They are move symmetrically with facial expression, etc. The eyelids, comment on that, and you're going to want to note the palpebral fissures and use the correct terminology in your video. If you don't know what words are, or you don't know how to say the word, Google it. Say, how do I pronounce this word? Because you want to be pronouncing things as correctly as possible. The eyelids, you're going to just look at each section in your book and note what they're stating like normal findings would be, and just comment on those things. And that will help you get the best score that you can. Let's see, what's the next part? Eyelids, eyeballs, conjunctiva, and sclera. So you're actually going to pull their eyelids down gently and look at commenting on color, glossy appearance, no drainage or redness, etc. And then you're going to do the cornea, the anterior eyeball structures, the cornea and the lens. So shine a light from the side across the cornea, and you're looking for smoothness and clarity. And that's a way to identify any potential irregularities or abnormalities that you might find. So that is part of your exam, looking at the eyes from the side. And then you can go on to the iris and the pupil. And there's descriptions in your book. I'm looking down at my Jarvis text, which, by the way, when I'm grading, is open to the same pages, and I'm going through everybody's video, and I'm like, pause, rewind, look at my book, look at, so you should be doing the same thing when you're practicing. Let's see, iris and pupil. Pupillary light reflex and accommodation. You're going to check for both of those things. So the light reflex is darkening a room, have the person fix their gaze on a distant object, and advance the light from the side, and note the response. Normally you'll see constriction of the pupil you're assessing and the other one, and then you'll do it on the other side. So you'll come then from this side, and you'll be like, okay, yep, that constricts, and so does this one. So you're watching for that. One time, just aside, one time I injured my eye and had actually a small piece of tile in my eye, and so I thought, well, if I cover this eye, it'll be fine. But you go in a dark room or a bright light, and it affects both eyes. So that was my pupillary light reflex in action, wreaking havoc on me. And then the other thing you want to test for is accommodation, and that one some people find a little bit tricky. So just read the directions. Accommodation is you're having them focus on a distant object again in a lit room, and that will dilate their pupils, and then you're going to have them shift their gaze to an object very close to them. It says 3 inches here, and their response should be the pupils should constrict and their eyes should come together. So that's accommodation. So make sure that you do that test as well. You're going to inspect the ocular fundus. There's many details in that, so make sure that you read these pages in your Jarvis text. Go through that. One of the things that you really should practice is on page 291. The best tip is match the sides with the person. So you're going to hold the ophthalmoscope. If I'm holding it in my right hand, I'm looking at the patient's right eye. And you want to do that so you don't end up bumping noses with the patient when you get in closer, because to do this exam you're going to actually have to get very close, and you're going to need to steady your hand on the patient's forehead so that you don't run into them. Okay, so those are all things that we're assessing, and you will lose points for if you don't do it correctly. So even if you're just using a pen because you don't have an ophthalmoscope, you want to follow the same principles where you're getting very, very close to the patient, and you're touching their head and steadying yourself, and you're holding your ophthalmoscope in the correct hand each time. And don't just do one side and then say, I'll repeat that on the other. You have to go through the steps on both sides. So make sure that you do that. Read all those points. There's several little spots that need to be addressed in there. They talk about the red reflex, etc. And let's see, and then you can talk next about the ears. You're going to inspect and palpate the external ears, so make sure that you do both of those things. You're going to note size and shape, skin condition, tenderness, and the external auditory meatus. So look through those things in your book again. And then you're going to inspect with the otoscope. And again, if you don't have one, pretend, but you have to pretend correctly. So you need to hold it correctly and brace your hand on the patient's face so that acts as a lever if they move away quickly, that they don't accidentally get injured from the exam. So make sure you're following the steps carefully. And then you're going to perform the whispered voice test, and that is on page 327. And this is very easy, but people change things in here and then lose points for it. So you're going to stand arm's length behind the patient, and you are going to have them occlude an ear, and it tells you how to do that. You've got to push in and out. And you're going to stand behind them, and you're going to whisper a combination of 3 letters or numbers, not words. So this test or exam has been validated through research and stuff using letters and numbers, not words. So make sure you do the test correctly as it identifies in the book. So, and then that should be it. Again, the same holds true here for getting maximum points for under 10 minutes, 10 to 12 it says, ideally under 10, and that you use good therapeutic communication. Again, do not use notes. You can't use notes at all on your final. If we see that you're focusing on one spot, constantly looking at the same spot, We will assume that there are notes there behind the patient or